If you or someone you love had a stroke and now speech sounds slurred or the words just aren't coming out right, it can be both confusing and frustrating. And here's the problem. Not all speech problems after stroke are the same, but they're often treated the same. Speech therapy for stroke patients usually focuses on two different issues: aphasia and slurred speech, which is often called dysarthria. One is a language problem and the other is a muscle control problem. And if you don't know which one you're dealing with, it's hard to know what to do next. I'm Evan, a neuro-occupational therapist, and in this video, I'll show you exactly how to tell the difference between these two and why that matters for your recovery. So let's break this down. So aphasia is a language problem, and it happens when a stroke affects the part of the brain responsible for understanding and producing words. Most often, this is on the left side of the brain. And here's the key difference. With aphasia, the muscles of the mouth work completely normally. So this is not a strength issue. It's a language networking kind of issue. Now, there are different types of aphasia depending on which part of the brain was affected, but at the core, they're all involve the disruption of the brain's language system. The thought is there, the intention is there, the idea is even there, but it gets stuck before it gets turned into a word. But this is where most people get confused, because from the outside, it can look like memory loss, general confusion, or even lack of effort, but often the person knows exactly what they want to say. The pathway between the idea and the spoken word just isn't firing smoothly. Here are a few common signs of aphasia. First is difficulty with word finding. You'll see pauses, searches, sometimes visible frustration. Second is saying the wrong word. They might substitute a related word without realizing it. For example, instead of saying chair when they mean table. And the third thing is difficulty understanding language. They hear you, but processing what you just said takes extra time and effort. And that's aphasia. It's a disruption of the brain's language system, not a muscle problem. And that distinction matters because language-based problems require language-based retraining. And now let's contrast that with slurred speech. Slurred speech after a stroke is called dysarthria. And this is a very different condition from aphasia. With dysarthria, the language system is working just fine. The person knows exactly what they want to say. The message in the brain is clear, but the problem is how the muscles carry that message out. The lips, the tongue, the jaw, and sometimes even your breathing may be weak and poorly controlled. So this is a motor control issue, not a language issue. Here are a few common signs of dysarthria. First, obviously, the speech is unclear and slurred. It may sound mumbled, thick, or like the words are just kind of running together. Secondly, speech may blend or rush. When they're talking quickly, clarity drops, but when they slow down, it becomes easier to understand. And that's an important clue. And thirdly, the voice itself may change. It may sound weak, breathy, monotone, or even low in volume. So here's the big contrast between these two. With aphasia, the idea gets stuck before it becomes a word. And with dysarthria, the word forms correctly, but the muscles can't deliver it cleanly. Both of these conditions after a stroke affect your communication, but they require very different types of retraining. So why does this difference matter? Because speech therapy for stroke patients has to match the problem. If someone has aphasia, strengthening the lips or tongue isn't going to fix the aphasia. You have to retrain the brain's language system. And if someone has dysarthria, language drills alone aren't going to solve the problem. You have to improve the motor coordination, breath control, and timing. Here's the thing, treating the wrong system slows progress, and that's where people get stuck. They get frustrated, and unfortunately they give up. But here's something even more important. Both aphasia and dysarthria depend on the bigger brain systems: attention, motor planning, endurance, even fatigue levels. If these systems are weak, speech progress slows, even if you're doing the right exercises. Speech recovery doesn't just happen in isolation. It's part of the overall brain recovery. So when you understand which system is affected, you can train more strategically and even see better results. Here's a simple way to think about it. If the person knows what they want to say, but the words just aren't coming out correctly, that's most likely aphasia. But if the words are correct and they sound slurred or unclear, then that's most likely dysarthria. And yes, I hear you in the comments. Some people experience both, but what matters most is identifying the primary limitation. Because once you know that, the next step becomes much more clear. So if what you're dealing with sounds like aphasia, I've made a full video up here to help you improve language after a stroke. And if it sounds more like slurred speech, I'll walk you through 5 exercises to improve your speaking clarity here. So start with one of these videos and I'll see you there.